we are going to talk about the kidney stones, a common affliction for many people, especially in the summertime. Why kidney is that important? Why stones form in the kidney? See, in our normal life, we make a whole lot of stuff in our body which has to be eliminated. One example is carbon dioxide, which is made whenever we move or whenever we breathe. Oxygen combines with the carbon in the food, and carbon dioxide needs to be eliminated. That goes through the nose. Lung exhales it through the nose. Now, there are other stuff that is not as volatile or can be converted to gaseous form, like sulfates or sulfuric acid, phosphoric acid, urates, or oxalates, a lot of other materials that cannot be blown off. That means that it has to be dissolved in water and removed as a liquid. That is happening in the kidney. Kidney is the organ to take care of lots of unwanted things. Now, the urine is made in the kidney. Kidney is around this area, and it goes through tubes in the called ureter, goes to the urinary bladder, from which it goes out. Now, the ureter is the tube from the kidney to the bladder. Usually that is where the stones cause severe pain. Now, stones can be formed in the kidney part itself, but usually it is in the ureter, this tubes. How do you feel when you get a kidney stone? Usually they say the only way men can experience the pain of childbirth is by having a kidney stone. The pain can be very intense, extremely severe, but it will be starting with a low level, go to very high intensity, then it comes down. After a few minutes, it may start again. And why the pain? Because the stones are like small crystals, small sand, okay? When it goes down the ureter, it scratches the walls, the membrane on the walls. That is what causes this intense pain. When it scratches, it also causes bleeding. So one of the first thing we do when a physician suspects a kidney stone, to get a urine sample and check in the microscope. Also in the microscope you can see some crystals. If it is oxalate, can form crystals. That crystals you can detect from the shape of the crystals in the microscope. Okay. Also red blood cells. Sometimes the pain can be associated with chills and fever. Means that very likely there is infection. That urine can be, you can use the urine to find out what bacteria is causing that. What other conditions? Like in summertime, especially if you don't drink enough water, the urine will be very concentrated. When things are concentrated, it has a tendency to clump together, crystallization. Okay, that is one of the common reasons. So, to avoid that, drink lots of fluid, especially in summertime. Now, when you get a little older, your thirst reflex will be a little lower. You won't feel, even if your fluid content is low, you may not feel thirst. So make sure, especially elderly people in a hot environment or in summertime, make sure they drink at least 3-4 liters of water every day. Okay, this is to prevent. Now, if the pain comes and the urine test shows, or X-ray, or ultrasound, or a helical CAT scan shows kidney stone, that has to come out, right? Best way, easiest way, but not always successful, but many times successful, is to go on drinking water, lots of water. Instead of 3-4 liters, you may have to drink 8-10 liters of water, okay? But if it is too much water, you may have to add a little salt, maybe to a liter, 1/4 a teaspoon of salt. Mix it, okay? So that your sodium level will not go down. That can cause problems too, okay? Now, there are other conditions that can cause other methods of treatment. If the stone is small enough, usually this is all what is needed, drinking water. Or else, if it is big, it doesn't come out. You may have to put a small tube with a loop at the tip that can go from outside, and we can hook the stone, bring it down. Okay. Sometimes that doesn't work either. In that case, with the sound waves, you can break the stones that can come out. Sometimes even that may not work. You may have to do surgery. But most of the time, what is needed is hydration and some stones which are not just because of the dehydration. Some are genetic, okay, like uric acid, they can crystallize. You may have to take medications for that, okay. And uric acid stones tend to precipitate, tend to become bigger in acid environment. In such a situation, alkalinization of the urine by taking some medication will help too. Now, it is fluid that is important, not whether you are getting in the IV through the vein, okay, which the hospitals tend to do, so they can charge, okay. Many times, drinking water would be enough, okay. If you have nausea, vomiting, cannot keep in the stomach, then IV may be necessary. Certain other things you can do. If some diseases you have to check, like there's a organs called parathyroid. That is, this area is thyroid, okay. Behind that there are 4 parathyroids. If they are overactive, you may have to take medications for that. Then some tendency which modern people have is to go on taking medication tablet after tablet, especially supplements, vitamin C, vitamin D, vitamin K, A, everything, okay, B complex. But especially vitamin C and D, taken too much can cause kidney stones, okay. So also too much calcium, that can sometimes cause that. So beware of those things, okay. Now other treatment I said is surgery, okay. Now the best method of management is to prevention. So try to drink as much water as you can. If there's infection, you need antibiotic, okay. But that the doctor will decide, okay. If you like what I said, tell your friends and also subscribe to this channel, okay. Thank you very much.